Hello cruel world. So as I said in my last video, hearing voices, auditory hallucinations, is much more common than you might think. So at any given time, around 2.5% of the whole population of the world can hear voices, and about 10% of the population have heard voices at some point in the past. So this is the second of a two-part series on hearing voices. Last episode I answered questions like, does hearing voices automatically mean that you've got a mental illness? Can people have happy or positive voices? And do I need treatment if I hear voices? And this episode is going to be much more about actual mental illness, including schizophrenia. So I'm going to tell you about the connection between hearing voices and violence. And I'm also going to give you a case example, which is one of my USPs, of a real life patient I've assessed who was hearing voices, in fact the voice of the rapper Drake, and she was charged with robbery, possession of an offensive weapon, and this was directly related to the voices she was hearing. Just to quickly introduce myself, pleased to meet you, my name is Dr. Sohom. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders so you don't have to. So, first question, which mental illnesses are associated with hearing voices? So as a brief recap to the last episode, there's lots of situations where you can hear voices that are unrelated to mental illness, such as lack of sleep, trauma either just as a natural reaction or when you develop post-traumatic stress disorder, drugs like LSD. So these are all non-pathological, there's no mental illness. When we're talking about pathological voices, which are related to mental illness, they can happen for a wide range of illnesses. For example, they can happen in depression and they can happen in mania. In these examples, the voices are usually mood congruent, which means the voices they match the state of mind of the patient. So if you've got mania and you're really elevated in your mood, you're really happy, you might have voices that are giving you grandiose compliments like, I've got the wealth of Donald Trump. Whereas if you're suffering from depression, then the voices are going to be negative. They might tell you to kill yourself, that you're worthless, or I've got the face of Donald Trump. Then there's alcohol hallucinosis. So this is quite rare and it tends to happen in very heavy drinkers, but it's having hallucinations whilst you're drinking. So I've actually done a previous case example of a patient who suffered from this disorder and he ended up talking to a toilet. So schizophrenia is probably the most well-known mental illness associated with hearing voices. Over half the people that have schizophrenia suffer from auditory hallucinations. So in depression and mania it's rare, schizophrenia is common. Although having said that, schizophrenia can present with other symptoms. So for example, delusions, which are like false, unshakable beliefs, or subtler forms of psychosis, such as formal thought disorder, which is when the flow of your thoughts is kind of mixed up and jumbled. So what you're saying doesn't make sense. In schizophrenia, the format of the voices is very variable. So usually it's one or two voices, but it can even be hundreds of voices. And also it can be a buzzing sound, or at least it can start off as a buzzing sound that later develops into full-blown voices. And often it comments on the person's actions, so it's called a running commentary. So the person does something in it and it's saying out loud, or it can be voice echoing, which is when you have a thought and then the voice echoes that thought seconds later. So those two things are pathognomic for schizophrenia. For budding psychiatrists, you might want to take note that they are two of Schneider's first rank symptoms. So these were first diagnosed by Kurt Schneider, as in, hey, where's that list of first rank symptoms going to be ready, Schneider? It's ready when I say it's ready. Stop hassling me. All right, no need to be curt. The other element that's important is whether the voices are heard inside or outside the head. And it's important because if it's outside the head, like you're hearing my voice going down through my microphone into the YouTube, into the ether via your computer, into your ears, if you're hearing it like that, then it's more likely to be psychotic. Whereas if you're hearing voices inside your head, it's more likely to be related to trauma, or it could be malingering. So it could be patients who are making up symptoms of mental illness to, for example, when I see them as defendants in trials, to either get let off their case or to have leniency in the sentence. I've actually done a whole series of videos on faking mental illness on my channel. You need to go check it out. So I should say that it's actually very rare for people who hear voices for that to directly lead to violence. I see this a lot because that's the kind of clientele I take on as a forensic psychiatrist. And in fact, it will be relevant to the case that I'll tell you about later. Often when it does lead to violence, it's because the voices are commanding command hallucinations. So that's when the voice is telling you what to do, like to hurt somebody or hurt yourself. And sometimes there's a delusion connected to hearing the voice, so the person feels that they have to listen to the voice. So I saw a man who heard a voice telling him to set fires and he felt compelled to listen to it. Or sometimes there's no delusion, but the voice is so compelling and it's so relentless that just to shut it up, you listen to what the voice is telling you to do. So I once assessed a man who was hearing the voice of his previous abusive stepfather telling him to attack any other patients on the ward with tattoos. And this seemed to be related to an argument he had in fact had with his stepfather when he was much younger about getting a tattoo himself, and he didn't feel that he had to listen to it. He wasn't controlled by the stepfather's voice, but he did it just to shut the voice up. So another question I'm asked fairly often is, can voices be positive? My answer to that is they can, but it's actually very rare. So if it's in the context of mania, having an elevated mood and being happy, then they can be positive. Also, if it's in the context of trauma, if you're developing the voice as a coping mechanism, that can also be positive, but it's far more common for it to be negative. So in my experience for schizophrenia, it's similar. The voices are often negative. They can occasionally be positive. I'll give you an example. I once remember assessing and treating a young man who was very intelligent. He had a PhD in philosophy, and he would hear the voice of other philosophers inside his head, and he would have these kind of pleasant, cathartic discussions inside his head. Yeah, so that's an example of a very rare instance where instead of the voice having a general theme, which they usually do, or saying the same things over and over again, this voice was like almost a separate entity inside his head. It had different personalities, different opinions. So it's possible. Next question, can people with schizophrenia still function without medication? So I kind of addressed this in my previous episode. The answer is yes. So firstly, medication is not the only treatment. You can have psychological therapy, which can help you in a wide range of ways, such as differentiating reality and the voices from what's actually going on. And as I said before, people with non-pathological voices, such as trauma or grief or lack of sleep, they don't need treatment, apart from maybe more sleep. So they shouldn't be treated. However, if it's pathological, especially if it's related to psychosis, then I think that more often than not, they should be treated. So that's not to say absolutely. So there are some people with chronic psychosis who have symptoms like hearing voices who function fine in the community. So they don't necessarily need to be treated. But a caveat to that is that I think they should be assessed regularly, because there's a risk their voices could deteriorate and their risk profile can change. So for example, further down the line, the voices might start telling them to hurt people or to hurt themselves. Obviously that can be dangerous, so they need to be followed up in the community. So after the break, I'm going to give you a case example where hearing voices led to a woman to directly offend. And the voice that she heard was none other than Drake. So I would like to welcome you to A Psych for Sore Minds. I'm your host, Dr. Sohom Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders, or what the tabloids might call the criminally insane. I work in prisons and in courts and in secure psychiatric units, and I also work as an expert witness to advise judges in criminal courts across the UK during their trials. So what I'm trying to say is, I am legit. So this channel, A Psych for Sore Minds, dissects a whole range of mental health topics, some related to offending and violence, as you're about to see in the case I'm going to tell you about, and some that are more familiar to the average person. So I have new episodes on Tuesdays and Fridays. You need to subscribe, because if you don't, you're going to miss out on something. So after this break, I'm going to tell you about the case of Miss A. So as always, when I tell you about this case, I've changed some demographics and details to make Miss A less identifiable, but the essence of what I'm saying is 100% real. So Miss A was a woman in her late 30s, and I assessed her before her trial. She was charged with robbery and possession of an offensive weapon. And what she did is she approached a random woman in the street in the middle of the night, and she demanded that she could swap cars with this person. And this person refused, obviously. And then Miss A pulled out a machete and threatened to stab her. So the woman let her have a car, but obviously called the police. Miss A was arrested. After she was arrested, she started making some very bizarre, kind of rambling, nonsensical statements to the police, which prompted a psychiatric assessment. So looking at Miss A's background, she had quite a harsh upbringing. She had like a turbulent life. There was some physical abuse from her parents. She had 2 older brothers, both of whom had been to prison recently, and she was bullied at school, so fair to say she had a bit of an uphill struggle. Miss A had some periods of mood swings. She used to drink heavily, she used drugs. She had what sounded like brief episodes of drug-induced psychosis in the past. And during these psychotic episodes, she would hear voices that would tell her to go on random missions, like, for example, to drive over to a service station and buy specific chocolate bars. She also had the experience of other people communicating with her telepathically, including her neighbours. To be fair, this often was in the context of smoking crack. As we all know, crack is one hell of a drug. Miss A had a few brief psychiatric admissions to hospital. They were usually for about a week or less, usually with drug-induced psychosis. So, leading up to her index offence, she'd become very preoccupied with Drake. I have to say, I think Drake is a bit overrated. I mean, he has some catchy tunes, but I can think of hundreds of better artists. I know when the hot light blink, that can only mean one thing. I know when the hot light blink, that can only mean one thing. Anyway, so I think I'm getting sidetracked. Miss A started having these delusions and these fantasies about Drake. She fantasized they were lovers, and then she heard that he was coming over to London on tour, and she decided that this was like a sign from him that they were supposed to be together. And then around this time she started developing auditory hallucinations, so she was hearing the voice of Drake complimenting her when she looked in the mirror, and Drake would tell her things like she was a princess and she was swapped at birth, and that she's the most beautiful woman in the world. She believed that Drake was calling out to her and that he wanted to meet her. However, he demanded that she did a mission first, and the mission was that she had to swap cars with any woman. So that's why Mrs. A was walking up and down the street looking for any woman that was getting into a car. And after about half an hour of doing this in a fairly built-up residential area, she found somebody. And when I saw her, she'd already been admitted to a psychiatric unit. Whilst she was in the unit before I saw her, there was some other bizarre behaviour. So for example, she put some packs of butter into her shoes without telling anybody, and she would like cut out the eyes of people in magazines and collect them. And I don't know this for a fact because she didn't admit it, but I do wonder whether she was hearing more voices that were giving her these other bizarre missions. She was also seen laughing to herself when she was in a room and shouting at people that weren't there when she didn't know she was being observed. All of this indicated that she was actually suffering from auditory hallucinations. So when I assessed her, Miss A had improved to a degree because she'd taken olanzapine antipsychotic for a few weeks, and she told me about the last couple of months. She told me about hearing all these voices. She said she heard the voice of Drake, she heard people screaming when there was nobody there, she heard like sex noises. So it might on the surface seem quite amusing, but it's obviously probably quite disturbing and scary as well. So for my assessment, I felt that Miss A had improved and she was now fit to plead. And I also said that I don't think she was open to a psychiatric defence because even though her actions were driven by psychotic symptoms, she still wouldn't have met the criteria for not guilty by reason of insanity because she knew what she was doing would have been legally wrong, even if she felt justified in her actions. However, even though she didn't have that psychiatric defence, I also suggested that she needed to remain in hospital for further treatment, clearly, instead of going to prison. So I think we can all learn a lesson from this, which is, if you hear Drake's voice, don't listen, he's bound to get you in trouble. But also, don't worry, hopefully you're not gone so far and there's some room for improvement. As long as you take care and potentially arrange a care package, then you can recover. By the way, I had to Google all of those Drake albums, so that shows you how little I know about Drake. Thank me later. Okay, so I've rambled on a lot. I have some questions for you, dear viewers, which are, have you ever heard voices? If you did have a positive voice in your head, what would it say to you, do you think? And what do you think of Drake? Please let me know in the comment sections below. Okay, so we're going to take a break and then I'm going to tell you what you can look forward to on this channel, A Psych for Sore Minds. So before I tell you about the next episode for A Psych for Sore Minds, I am very excited to share with you guys some news, which is that I'm going to be a speaker at CrimeConUK in September, previously June. This is a massive crime convention, really popular in the States, coming over to the UK in London for the first time. You will learn about serial killers, unsolved crimes by criminologists, law enforcement agents, your favourite podcaster. I will be doing a talk about 2 real-life cases of people that I've assessed who have killed their own family members, one who was mentally ill and one who wasn't. So if you are a true crime enthusiast, you have to cop tickets. You can use the link on the description below, and if you use the word psych, then you'll get a 10% discount on your tickets. I've got your back. So look out for my future episodes. I have numerous episodes answering your questions from the internet. I'm also going to do a video in the very near future about misconceptions about psychiatrists. So please subscribe to our YouTube channel. Not only does it help me out immeasurably, but it reduces the general traffic in your area, especially around rush hour. So comment more, please. I'd love to chat to you guys. And follow us on Instagram, like our Facebook page, submit an episode idea to our email address, which is psychforsoreminds@gmail.com. And tell your favorite people about Psych for Sore Minds, because they deserve it. Spread the love. Until next time, stay euthymic, and please do not forget, I love you. Having said that, leave me alone, go away.